Hello, I'm Dr. Frances Pitzilis. Yes, regular painkillers can damage your heart, particularly the non-steroidal anti-inflammatory type. A lot of people need non-steroidal anti-inflammatory drugs and other drugs, and altogether several different types of painkillers for various health conditions as they get older. But as they get older, they're more at risk of heart disease, stroke, kidney failure, diabetes, and older people tend to get more inflamed anyway. So there is a risk that the side effects of the non-steroidal anti-inflammatories can actually damage the heart, the brain, and the kidney. So how does this happen? Well, this is because doctors have known that non-steroidal anti-inflammatories have had a general effect on the kidneys, and I've observed that they've had a tendency to slow the kidneys down. It wasn't until 2004 that the selective COX-2 inhibitor drug called Vioxx, and that's the brand name, was taken off the market because it became clear that it increased the risk of heart problems and heart attacks. Since then, some of the other drugs have remained on the market, but along with a warning that it can potentially increase cardiac events, as well as potentially causing bleeding from the stomach and the bowel. Also, to some degree, it can affect the liver. So how are we going to deal with this? Well, I think it's about weighing up risk versus benefit. On the one hand, we need some relief from the pain, but on the other hand, we need to look at that person's general risk profile and their general health and have a look at whether they can take that risk or whether they should be looking at something else. Now, the general approach to managing pain is as follows, according to me. Try first any method that's not drug-based. If we're talking about musculoskeletal pain, can we go to a body therapist that will help align everything so that the muscles and the joints are not complaining as much? Can that person have a non-surgical procedure like platelet-rich plasma if it's osteoarthritis of the knees or hips that we're talking about? Can it include physiotherapy, heat, cold, and other physical supports? Diet. In the case of rheumatoid arthritis, avoiding gluten can be part of a program that can support that person. Can we look at correcting nutritional and hormone imbalances? When it comes to that, you can potentially get a lot of benefit with autoimmune diseases and other conditions that are inflammatory. Including fish oil in the regime can be useful. And when it comes to drugs, we know that any drug taken for 15 days a month will increase pain. So in the case of chronic daily headache or migraine, we know that people will get rebound pain then if they don't take their drugs for their pain. So then we get into a vicious cycle. So in my point of view, the first drug to consider is Panadol Tylenol. So that doesn't have the sort of side effects that the non-steroidal anti-inflammatories have, although it has other side effects and you can't take too much of that. Continue with your natural supplementation and try and use other drugs like codeine associated with Panadol, Tylenol, if you need a little bit more pain relief before you go to the non-steroidal anti-inflammatories. Can you use a localized non-steroidal anti-inflammatory cream on the tissue or the joint? Can you use tricyclic medications, anti-epileptic medications, and some antidepressant medications to help with pain? Then we'd be forced to look at the non-steroidals, and then after that we really don't want to unless that person has cancer, but then we might have to look at narcotic drugs. Or do we ultimately need surgery, but that's probably the last thing we ought to do, unless it's a really foregone conclusion that that person needs surgery no matter what you do. In that case, you'd better get on with it and do it and save all that drug exposure. So in the end, it's about trying to be conservative and safe, use natural methods first, use body therapy, be sensible with the drugs, and talk to your doctor about your risk versus benefits. If it's for a short period of time, your risk is not as obvious as if you're going to be on something for a longer period of time.